Hey guys, welcome to Get Real with Rick Dancer, and I'm pretty excited about this because I'm a man. This is Dr. Chris. What's your last name?
We verified that.
They're going to do tests to make sure that that's proved.
Christian Ferry, Dr. Ferry.
And so you're a surgeon. That's your practice. That's what you've done for years.
Right. Surgical oncologist.
He also has a winery, which I think is cool. Just another sidebar kind of thing. But we're here today because men's clinics are starting to pop up all over the country, and there's not really a lot of them on the West Coast.
And there is in California, not on the Northwest. It's a real vacuum for this services.
So you're one of the first ones here. And so what does a men's clinic do?
Men's clinic sees guys and follows them over time and helps them with their needs. The main thing that this clinic does is testosterone replacement, but we do a variety of things centering around nutrition and well-being and vitamin supplementation and getting essential health issues back up to speed.
So testosterone replacement therapy is kind of, it's been around, but it's evolved into something.
A long time, actually.
Yeah, but this isn't something where this the guy at the gym shooting testosterone into his stomach to try to build up his muscles and everything. This is pretty scientific, and you're putting a lot of other things in there as well.
Right. There's a lot of components that go into a balanced and safe approach to testosterone replacement, and those are essentially getting the patient to the right value or the right level for them, not a specific number, but a actual effect. Also, keeping it safe because testosterone can drive up your hematocrit. We have to watch that. That can be detrimental if it's too high. So we typically watch guys for those ranges. It also drives up your estrogen levels if you're not following those. That can be counterproductive in having too high of an estrogen with a higher level or an adequate level of testosterone, because that can lead to other symptoms. So we follow that in every single patient. And then also, if you just take testosterone alone, what that does is it shuts down your own endogenous testosterone production.
And that's what men are always afraid of, and you guys take care of that.
Right.
By doing what?
Well, there's other medications and other regimens that support your own testicular health and your own production of testosterone. And typically, when somebody starts with us, they're at a low level because they're on that andropause curve, if you will. And so we supplement their regimen with other medications that support their own testicular health, and they actually increase their testosterone level endogenous. So usually when we start somebody on testosterone, we're starting them at a higher dose and then down dosing it over time.
So what is it? What do men notice? So all of us, I'm getting close to 60. All of us, our testosterone starts to drop. That's a man thing.
Right.
And we're ashamed of that. Some of us, when we first find out, some people are like a little embarrassed because it's like, I don't want to, that means I'm not a man, which it doesn't. It's just a natural part of life.
Yeah, it means you are a man. In North America, it means that your testosterone is decreasing usually at a rate of about 1% to 2% per year throughout your life. And then when you're older, it kind of plateaus because it's very low to be already. It's happening more dramatically in younger guys in their 20s and 30s, and they've statistically lost more. They're lower on that curve than the older guys that come into the clinic.
So that's really interesting. And we don't know why. Science doesn't really know why.
Oh, there's theories, but not really a comprehensive proven theory.
So what happens when I start losing my testosterone levels? They start dropping. What are some of the symptoms guys are coming in here for to you?
Well, we have scales and we have a survey on our website.
It's extensive.
Yeah.
They sent one home with me just because I wanted to see what it is. But it's good too. It makes you think.
Yeah, it's different for every guy. It really, truly is. And I'm astounded at that. Every single guy who comes in has a different sort of take or a different complex, a symptom complex. But the main thing that guys want to have their testosterone replaced for, and the main reason why people stay on testosterone replacement, is for energy. It helps restore your energy, helps restore your mental and your physical energy. Testosterone's highest in the morning naturally, and then it decreases throughout the day, sort of like a currency, and so or a commodity, and you use it up. So getting on testosterone replacement kind of keeps it steady throughout the day, so you don't lose your energy and lose your drive in the afternoon. The other main thing is mood. With low testosterone, guys can have anxiety or depressed mood, and that's one of the main things that we treat.
Guys coming in for depression, and then weight gain.
Weight gain is about 50 to 60% of our guys. One of their main goals is to lose the fat that they've accumulated over the years. And with the testosterone or andropause, testosterone dropping, it kind of, for some reason, resets your fat point. It makes your body want to have more fat. And it's harder to keep lean muscle, harder to lose fat, and harder to keep strength with a lower testosterone level as opposed to a higher testosterone.
So Chris and I have been talking too, because I'm really interested in this. So testosterone levels are kind of weird too, because the average is like huge.
Right.
So there's no really, it's not like you can say, well, if you're between 400 and 700, this is, because it's, what's the average?
The scales, which are set by laboratories and insurance companies, are between 250 and 1100. So it's a pretty wide scale. I mean, when a guy is 16 years old, he's typically 1100 or 1200, but goes down from there and goes down pretty quick. And so my take on it and my impression, and a lot of smarter endocrinologists than me, and throughout the nation there's a lot of these clinics, and they're very large, very scientific, and very good in the way they approach this. I think of it as it's a medical problem that can be addressed. Sort of like if your thyroid's low, you get thyroid medicine.
Right.
Here we have a situation where your testosterone's low, it's causing a multitude of symptoms. You replace your testosterone and you reverse those symptoms, you reverse that effect.
And you guys, we're going to be doing one of these a month for the next 6 months. And the cool thing is that we've already met people. They have 150 clients.
Here in Eugene, yeah.
Here in Eugene, 150. They also have a clinic in Bend. And plans to put more in the Valley because this really is something that men, well, one guy that I know, that's how I found out about them. His whole life has changed. He feels better. He's more alert. His wife's happy because when he comes home, he's not sitting on the couch and just being what looked like lazy. It's that he has no energy.
Yeah.
So now he has his energy back. So he's like a new guy.
Yeah, and it compounds on itself. I think that essentially it helps in your mood, it helps in your drive, it helps in your ambition, and it helps with your energy, so you're able to pursue the things that you not only want to do or have to do, but what you want to do. Get back to the things that you used to do, or new pursuits, or have the energy to interact with your family and your kids, and enjoy your life.
Right.
Which a lot of guys with low testosterone have kind of lost that art.
Now, how did you come up with, because you do this.
Right.
You're on testosterone replacement.
Of course.
So how did you come about this? You're a
Yeah.
surgeon. You make wine on the side, which is more than a side project. But
Yeah, interesting. I just was experiencing all the same problems with fatigue and concentration difficulties and libido and you name it, and I didn't really know what it was. And my brother, who doesn't share a lot but takes care of himself really well, he started on testosterone about 10 years ago. He's
Wow.
an Air Force pilot and kind of got wind of it and started it before these clinics were available, and he and his buddies were just trying to figure it out on the side. They weren't doing it correctly because they weren't doing the testicular support and watching their estrogen and that kind of thing, but he immediately saw that it was amazingly beneficial to him, and he feels like it's been transformational for him as well as a lot of other guys that he knows, and he blabs about it to everybody that I think of.
This is the brother talking about
for the
brother.
last 10 years. And so I finally started about 6 years ago, and obviously I just fell right into place with all of these guys that I know now the effects are. And I was able to lose weight, and I was able to actually have the energy to do big cases in the afternoon and pursue all the things that I wanted to do, and actually started doing more of the things that I had lost doing just because I didn't have any energy after work. So that's kind of how it started. I tested it on myself, and as time went on, my brother would be up here and he would say, "Hey, where's the men's clinics? Where do guys go for help? Where are they getting their testosterone?" And the answer is really nowhere around here so much. Some doctors help patients with it and they replace it, but there's a lot of components to it, and you have to be on top of it, and you have to have a regimen. and you have to have a system in place where you don't miss problems, because there is pitfalls with giving testosterone alone and testosterone without the monitoring in place. So,
right.
So that's kind of why we started it, is because I felt that there was a huge need for it.
You guys, real quick, I want to tell you, because it's on the top, but I didn't mention this, and I see Darren's on here now. Darren is opening a new Bangers and Brews business here. There's one in Bend.
Yeah.
You guys have a clinic in Bend. They have the first one is in Bend. This is like the #1 restaurant on Yelp, and it's going to open in Eugene in March. And so I called him on the way.
They have one in London too, Bangers and Brews.
Yeah, well, this is good. I called him on the way over here, and I said, hey, we're going to be talking to a bunch of guys about health, and I can't think of anything like a banger that's going to be attractive to a guy. So they're going to give a $25 gift card. All you got to do is tag 2 people in this and like the page. And I'll put you in a pot, and we'll pick a winner, so you'll get a $25 gift card. They're not open until March, but they said, yeah, we'll do it. That sounds like a great idea. And I thought, that's a guy thing.
They're opening in March.
They're going to open in March, yeah, right over there by Sheldon, across from Sheldon High School,
Oh, yeah.
the old Ron's Island Grill.
Yeah.
So he said, yeah, we'll do that. We like the idea. So tell me now, we're going to get a little sensitive here, but this also helps with erectile dysfunction. As you see, is that a big reason people come in here?
Well, it's funny, if you look from the outside, a lot of other doctors and guys and women think, oh, that's what this clinic is. It's a sex clinic or erectile dysfunction clinic or libido clinic. And it's a pretty universal benefit of testosterone replacement. And almost all guys have improvement in that arena. And some guys, it's one of their main goals or one of their main benefits that they look for. But it's by far not the top.
The fatigue and depression and that kind of thing is the hardest.
Fatigue and mood and getting your energy back, getting your drive back, getting your mental endurance back, getting your mojo back is what guys want.
And I think we're sometimes embarrassed to say that, but as a guy, you want to be a guy.
Yeah.
And you want to have that mojo, that thing that says it's not just about sex, it's about the whole package, the whole thing that goes on.
Yeah.
And
I mean, you want your swagger back, but these guys that are have been low testosterone for a long time, they're so far from that. They just want to be able to get off the couch. And so, it's a few months into it before they really start thinking about all the things that they can do again. A lot of guys, they just want to have the energy to reverse the things the effects that have happened to them over the years.
So when you do a blood test, what other things are you looking for? You're checking PSA, you're checking, which is for prostate cancer and things like that. You're checking what other kind of things?
We check a multitude of different laboratories in addition to taking a history and figuring out from a clinical history what's going on with that patient and the surgical history. We check their blood levels, their liver function tests, their kidney function tests, their vitamin D, which so many guys are deficient in vitamin D, and that's kind of goes along with mood as well, and has other bone health and muscle health as well, and also fat reduction. There's thyroid function tests, prostate specific antigen. We check your propensity for diabetes, and about 5 or 6 other things.
So this is more than, why TRT is the bigger focus. All that other stuff for a guy, this is where you go to find out about guy stuff.
Right, and you can't, focus on one thing and fix one thing while all the wheels are falling off the bus. You got to have everything going.
So Chris, what do you like most about it? Obviously it's helped you.
Yeah.
And you're a busy man, because I hear you go home and you work at the winery like 3 hours after. You can't have low testosterone and be doing that. That's not going to work.
It's not.
But when you see guys coming in here, I've seen a number of people that I've known coming in here, and they're one guy walked up to me and goes, "I'm happy again,"
Yeah, it's been very rewarding to see guys almost get their lives back and get back on track and get doing the things that they want to do, not just that they have to do at work, but what they want to do. And a lot of guys have rekindled their relationships with their family and their wives on a lot of different levels. And seeing a guy come in and tell you about how he's changed his life for the better, and these are going to be long-lasting trends in this guy's life. They're probably going to be adding years to his life, especially in guys that have lost 50 or 100 pounds, which that happens in this clinic a lot. but quality years.
Right.
Not just years, but quality years.
So we're going to go in and I'm going to do a blood test so I can see what my TRT is or my testosterone level is. And so somebody's going to do that for me.
Yeah. I'm not very good at drawing blood.
So I do not want him. Yeah, no, he's a good surgeon, but when it comes to drawing blood, we have experts here.
I take the blood out of here.
yeah, that's really great. Thanks, Chris. So again, it's Hale Men's Clinic. It's over by Valley River Loop. That's what the street is, right?
Village Loop.
Village Loop. So it's across from Kendall
Auto.
Yeah, Auto Complex over here. Back in there, there's a Mexican food place, Remax, all back in there. The bagel place right next door. That's where they're located.
Village Plaza Loop.
And I put the number and the address at the top there so you can find it. So again, one more time, tag 2 people in this and you'll be eligible to get a $25 gift card for Bangers and Brews, a new restaurant coming to Eugene. If you are one of those guys who's struggling with things and you're just thinking, well, this is just how my life is, it has been for the last 10 years or 5 years or whatever, this might be, to come in and have just a consultation. What is?
It doesn't have to be. So what we do is, our gals will talk to you and just actually get a testosterone level. Sometimes guys know that their testosterone level already is, and we get a full panel and just start them. Some guys want to just talk first and not get labs, and so everybody's a little bit different. But you can come in and get your testosterone drawn for free here.
And the other thing is, insurance covers this a lot of times.
It does, yeah.
So if you have, insurance, if you have insurance, they can check on it. They'll know who to check with and all that kind of thing to make sure that it does cover it for you.
Right.
All right. I'm gonna go next door.
Okay.
Is she over there? I'm gonna grab my machine here. I'm using one of their pans. All right.
It's a mayo stand.
This is the cam. Do I just sit here?
Yeah.
Okay, I may have to do it down this way because you're going to be kind of. Which arm do you want?
Doesn't matter to me.
Okay.
Whatever's comfortable for you.
Yeah, comfortable. Of course, this has happened to me. So, having prostate cancer, I do this like more than most people, so it's not like that big of a deal anymore. So again, you guys, we're at Hale Men's Clinic, and it's here in Eugene, fairly new. They have 150 clients already. And if you are having issues or don't know that you're having issues, but you are not up to par, not feeling like your guy, you got your mojo, this may be part of your answer here. So I'm going to put this, here's what I'm going to do. I'm going to grab this stool.
Can you hold that?
I think I'll be okay because I think you're going to be right there, right?
Yeah, that'll work.
Okay.
All right. So, I think we're going to draw you for an initial panel today, which is kind of our first big lab panel. And
Erica, you want to sit?
I'm okay.
Okay.
Now we'll see who pays attention.
All right, big poke. So we do 3 vials for this first one. Oh no.
You working?
Sorry, you're being moved away from me. Of course, we're doing this on camera. Huh. You okay with me trying again?
Yeah, yeah.
Okay. This
I
for a
have
second.
really weird veins.
Do you?
Uh-huh. I have veins because I work out a lot. So I've gone to clinics and they go, God, you have all those little suction cups in your vein, and it's really hard to get you going.
Is it?
So that's what I get for working out, I work out all the time, I work out hard, and then I get cancer.
Oh, no.
Yeah.
Yeah.
It's like, yeah, okay, I don't eat fast food, and then it takes
Okay.
my thing.
Let's hope the second time.
So again, you guys, if you tag this page with 2 people, you'll be eligible to win a $25 gift card to Bangers and Brews, a brand new restaurant that's going to be opening here in Eugene in the first part of March. And Darren is right there on here. He's the owner, and he told me today. I would be glad to do that. So you got to tag people, 2 people, and then I'm going to pick a winner. And again, we'll be back here every month to kind of show you more. We're going to introduce you to people who've been through the treatment, guys who've been through the treatment, or tell their stories, talk to their wives and find out how life is different for them. And when we come back next month, I'll be able to find out what my testosterone level is. And I might share that with you and I might not. It's kind of my medical choice if I want to. But again, it's called Hale Men's Clinic in Eugene. And yeah, Darren, it's very cool. So you, like Chris said, you could come in and have your, the consultation and a blood test, and that's not going to cost you anything. And insurance usually pays for this when you get the treatment. So if you need that, all right, that's all there is to it.
I'll have you hold pressure there for a second.
Okay. All right, you guys. So that's it. Tune in tonight at 7:30. We're going to be live, 7:30 to 8, right around in there. We're going to be live at the Eugene Symphony. They're having a big performance tomorrow night for Valentine's Day. Go ahead, you were not going to hurt me. And so we're going to be there talking to the star performer, a pianist, and we'll also be with David Kammerer from Summit Funding, who is on the board and is sponsoring our show. So again, we're at Hale Men's Clinic in Eugene. A new thing for our area, men's clinic, so it's kind of cool. Yeah, Jason, I know you guys have them in Bend. Well, they have one over there in Bend, so it's probably the same people. All right, we'll talk to you guys later. Thank you. Share this on your page.